Thank you for agreeing to participate in today's simulation. We hope that you find it a useful way to practice your clinical skills. We'd like to take this opportunity to introduce you to two important people, Sim Junior and Sim Baby. This is Sim Baby. She can't talk yet, but she can cry and cough. She breathes and has lung sounds. She can develop quite marked work of breathing. She has bilateral femoral pulses and a left-sided radial and brachial pulse. You can take her blood pressure manually on the left. She attaches to monitoring, which might provide you with oxygen saturations and an ECG tracing. Be careful if her saturations drop because she might become cyanosed. You can insert an intravenous line into her right arm, and this can be used to take blood or administer medications. An intraosseous can be inserted into her replaceable legs. She has interchangeable pupils, a raised fontanelle, can simulate a seizure, and might need an orogastric tube placed if she has abdominal distension. She also arrests regularly and can have airway adjuncts inserted and can be intubated if necessary. She can have compressions, can have a right pneumothorax decompressed, and can be paced or defibrillated. There are some signs which you might look for which Sim Baby cannot replicate. These might include pallor, prolonged capillary refill, increased reflexes, or poor tone. If you are looking for any of these signs, ask the nurse who will clarify whether they are present or not. Sim Junior has similar capability. Don't forget to say hello. He can breathe, and you should be able to hear his heart and lung sounds. However, you might need to clarify how hard he is working to breathe. He has bilateral carotid pulses and brachial and radial pulses on his left side. He shakes his head very fast if he is having a seizure and can also blow a pupil. He often requires cardiopulmonary resuscitation and can have airway adjuncts or an endotracheal tube inserted if required. Watch out for laryngospasm. He can also be cannulated on the right arm or hand and can be given oxygen and medications. Like with Sim Baby, there are signs that cannot be replicated, so if you are unsure, ask. During the session, you will be asked to attend to an emergency situation. As you enter the room, you will be greeted by a nurse who will provide a handover and then assist you through the scenario. There may also be an assessor or someone controlling the mannequin in the room. If they are there, just ignore them. We'd like to reiterate that this is intended to be a safe space for learning. We understand simulation can be stressful and that sometimes people do things that they would never do in real life. We'd like to reassure you that your performance today will not be used towards any course assessment and will not be discussed with any other students or staff. We'd like to thank you for participating in the simulation today and hope you find the experience rewarding.